Hello everyone, I am Shilpa Ladhe, Project Manager, Ideal Medical Solutions. Ours is a consultancy company which has a good experience in managing and creating a positive organizational culture in various disciplines of healthcare sector such as after hours GP services, immunization and chronic disease management, mental and sexual health and other allied health services. We are dedicated to provide solutions that help healthcare organizations promote positive outcomes, overcome the complexity of their structure, and develop cost-effective business plan while maintaining the integrity of every individual and the organization as a whole. Organizational culture represents values, behaviors, goals, attitudes, practices, and beliefs shared across the entire organization. Healthcare organizations are best viewed as comprising of multiple subcultures which may be the driving force for any change and also affect quality improvement initiatives. Let me begin with a quote from Aubrey Daniels, a clinical psychologist who later founded this company, Aubrey Daniels International. I quote, "We can change culture if we change behavior," I unquote. Let me elicit a small example. We all know the importance of hand hygiene in clinical practice and its impact on reducing hospital-acquired infections. Now, to encourage the staff to perform the right hand hygiene protocol, we need to motivate them with the right perspective. This is how a patient-centric approach in developing a positive organizational culture will lead to a positive outcome. A positive organizational culture not only improves the productivity and efficiency of the employees, but also improves their commitment to their work. This in turn can help reduce the turnover cost, like in the case of hospital-acquired infections. A positive culture focuses on meeting the essential human needs of the staff, and this is what will help the organization thrive in the challenging times. Development of a culture requires a clear strategy which involves creative leadership, effective communication, and efficient collaboration across all the departments. Healthcare industry is a company where staff culture goes beyond the employees and actually affects the patients and other users of the health service. In many ways, the healthcare industry is the one which relies on its culture more than the most. Happy and engaged workers can have a positive effect on those using the service. Culture is a way in which organizations make decisions about what they are going to do and what not, and the way in which the employees experience their jobs and lives at the workplace. Both of this directly influence the type of care the patients experience. Positive organizational culture can be seen as a force of cohesion in an organization and therefore can support or inhibit any process of change. As stated by Namita Seth, MD of a consultancy firm, I quote, "Change your organizational culture and you change the patient experience," I unquote. Today, me and my team members James, Ahmad, Khurshid and Tejal will be presenting our strategies on accomplishing the key performance indicators of achieving magnet-style recognition for staff, promoting fiscal responsibilities, developing a transparency in the administration and consumer empowerment across all the 6 sites of operations, and how these aspects can create a positive impact on the patient outcomes. I now request my team member James to speak about achieving magnet style recognition for the staff and developing opportunities for indigenous people.
I am James, one of the consultants in Ideal Medical Solution. I'm here to talk about ways of achieving magnet style recognition for staff, for all staff, and increasing the employment and development opportunities for indigenous people. For this to take place, there have to be a strategy in engaging all employees of Western Primary Network. Employee engagement is a desired condition for both the company and staff alike, and it has organizational purposes, and it connotes involvement, commitment, passion, and there's a focused effort and energy, so it has both attitudinal and behavioral component. It's more or less a heightened emotional, intellectual connection that an employee has for his or her job, for the organization, manager, or even co-workers. And this in turn can influence how staff apply better judgment to the job they do. And there are key few drivers that will make staff engagement achievable. Trust and integrity. And by this I mean, how well do managers communicate with staff, and how can they walk the talk? The nature of the job. Is it stimulating? Is it mentally stimulating on a day-to-day basis? Does staff finish work and go home satisfied? Do they have that pride in them that they are achieving something? There's also a career and growth opportunity for all staff. That means that the company has to provide opportunities for staff to grow and have to make ways so that this growth will impact on the development of all the organization. There has to be a line of sight between employee and manager. And by this I mean, how close is the management to the staff? There have to be employee development. And this is giving employee a voice. Because as a major stakeholders, providing them incentive to develop and provide feedback so that the company will grow. Building relationship with one's manager. The organization has to be willing to practice and believe that everyone is a caregiver. And by this I mean those that work in the food department, those that work in the transport, and even the accountant. They have to make patient the central focus. And this can influence on patient experience. There's one key component that we have to talk about, and that is how do we get indigenous people to be involved. We have to create a culturally safe and inclusive environment for indigenous people. And by this, we have to make the environment sustainable and create opportunities in all the local districts. It is critically important to implement a feasible plan that delivers results by improving awareness of indigenous culture in the workplace and increase the representation of employees in senior roles. Indigenous employees should be equipped to progress their career in the same way as non-indigenous people and have equal opportunities to demonstrate their stability for promotion. When staffs are engaged, when there's commitment from all staff, when there's willingness for caregivers to see everyone as equal, and the leadership in their part are willing to create culturally safe environment for all the staff, irrespective of where you work, then they will be good. And there have to be a system where we can attract and retain indigenous employment by encouraging personal growth through mentoring, professional development, and training. There have to be targeted recruitment and selection processes where preferred candidates are listed in certain positions. And when we do this, we can also have inclusion. To conclude on this topic, engagement is very vital for both indigenous and non-indigenous people, indigenous staff. And we can measure this by having staff feedback and having community involvement. I'm going to let my next consultant, Ahmed, speak on promotion of financial responsibilities and how this can help all of us, all the staff, to grow the company. Thank you very much.
Hello everyone, my name is Ahmad Alkiswani and I'm one of the consultants of the financial team. What we're trying to do is to promote fiscal responsibility across the whole 100 frontline team members. So what is fiscal responsibility in the beginning and why it's important? So fiscal responsibility is about ensuring that fiscal decisions are not dominated just by present consideration. It's also concerned with future ones as well. So it means that recognizing that decisions that directly affect the future, like borrowing, asset creation, arrangements, government guarantees, which all of that can create liabilities for the hospital or the company. All that should be guided by medium or long-term plans or objectives that can generate equity and minimize financial risk as much as possible. Now, this is in general terms. This is the final definition of fiscal responsibility. Now, let's focus more on how to promote this fiscal responsibility in the 100 frontline healthcare workers. We want them to interfere in the decision-making process, especially the financial one. So each profession will have different responsibilities. It's dependent on the field mainly. So for example, doctors will have different ones than nurses and pharmacists and so on. In our project, we will focus on three things, three main professions: doctors, nurses and pharmacists. We are not dismissing the other ones. We're just saying that those are the most concerned with financial abilities, and they affect about 70% of the equation. So let's start with nurses. Let's start with nurses and the scheduling. So nursing labor is one of the largest patient care costs in a hospital. Unlike certain medical services such as rehabilitation therapy, nursing services don't generate revenue in general. Nursing is considered a cost center. Therefore, hospitals strive to maintain enough nurses on duty of proper care and safety while not incurring excessive costs. So nurse managers are charged with figuring out how to responsibly and cost-effectively staff their departments through weekly, bi-weekly and monthly schedules. Now let's talk about the payroll in the nursing department. So although certain hospitals use computer systems that monitor employee activity, nurse managers often have to submit payrolls for their departments. Even in facilities with advanced time-keeping system, nurse managers have to review and validate payroll reports and coordinate with the human resource departments about employee leaves, vacations, and illnesses. This is important for managing labor costs, basically. Talking about supplies right now, nurses have to relatively high access to medical supplies in general. However, every syringe, IV bag, tongue depressor costs, everything costs money. So hospitals rely on nurses' choice when using such supplies. Nurse managers are tasked with keeping an eye on supply, encouraging their responsible use, and when necessary, allocating or rationing them carefully. Nurse managers need to make sure nurses have what they need to do their jobs, while at the same time encouraging fiscal responsibility. The last part in the nursing departments is insurance utilization. So hospitals have to be mindful of what patients' medical insurance plans allow. When providing services and making patient care decisions, nurse managers have to consider which interventions are covered and which may cost the patient or the facility substantial sums. Among other things, nurse managers review patients' cases with nurse case managers and floor nurses to ensure that care delivers are in the best possible way with hospitals and to put into consideration the financial costs. Now let's move to doctors and general practitioners. So doctors in general seek opportunities to formally engage in healthcare financing and funding processes. Decisions to actually engage should be made on case-by-case study, making a judgment on the expected value of involvement against possible risk in general. So in particular, doctors should request information on the impact of the proposal on current and expected health outcomes on their financial sustainability. So the process for developing and revising healthcare resourcing and expenditure policies should be transparent, consultative, have appropriate oversight, and be consistent with good medical practice. Considering and advising on how healthcare proposal will work or not work from a clinical perspective, we should focus on three parts. So identifying what a positive and negative impacts on a proposal may have on a clinical care, also including its fit with clinical workflow and the practical operation of medical practices. Another point is impacts of the proposal on the wider healthcare system, including unforeseen and adverse impacts. Lastly, sustainability of the proposal. Our patients' needs, demands, cost, and performance is manageable over a prolonged period of time. Now we're done with doctors, let's move to pharmacists. So pharmacists are usually facilitate almost 22% of the main cost or expenditure in hospitals, which is growing every year. So pharmacists play a crucial role in managing the introduction of cutting-edge medicine. And on behalf of our members, we welcome tonight's strengthening of the life-saving drug program, including the introduction of additional listing. What do we mean by that? We would welcome further consultation on how medicines remuneration can be best managed to achieve optimal health outcomes for all Australians. Also, the organization tend to stand to support for funding of education, training modules, and to promote dispensing of generic drugs, not the original drugs, because they cost less. Also, hospital pharmacists have led the way supporting great use of these medicines, which are comparable quality, they are good in safety, efficacy, and they are lower in cost, as we said. We believe if we focus on those three professions, we tackle them in the beginning, and we leave the other professions for the end, we can solve more than 70% of the issues, financial issues, let's call it, and we can promote fiscal responsibility for all the hospital after that. Thank you so much. Now I will introduce my other partner who will talk about corporate governance in the hospital, in the 6 sites.
Start.
My name is Khurshid Alam and I am the consultant for transparent corporate governance in all 6 sites. Today I will discuss about the corporate governance. First, I will introduce what is corporate governance. Corporate governance is defined as a procedure and process according to which organization is directed and controlled. The corporate governance structure specifies the distribution of right and responsibility among the different participants in the organization, such as board, manager, and shareholder and the other stakeholder, and lays down the rules and procedure for decision making. Now I will tell you about what is the importance of corporate governance. Healthcare governance is a framework for improving quality of care and access by increasing accountability and promoting transparency for all the excellent outcome of healthcare. Healthcare governments play a vital role in improving patients' experiences in healthcare and share learning from the experiences by promoting openness and culture accountability. To create a transparent corporate governance, we need principles and guidelines. The principles and the respective guidelines address 5 major domains, which will left and link in the construction of enhancing the overall governance practice in all 6 sites, like corporate and clinical governance, board of director, adult control and risk, hospital sustainability and responsibility, disclosure and responsibility. These principles and guidelines are designed to lead the process of becoming a well-governed and transparent healthcare organization. Our main guideline in this project is the Code of Ethics to provide a structured background for all the professionals to ensure that we provide high quality, safe and authentic service. What are the basic principles of this Code of Ethics? Is upon refer to 4 basic principles of healthcare ethics when evaluating merits and difficulties of medical procedures. Ideally, for a medical practice to be considered ethical, it must respect all 4 of these principles: autonomy, justice, beneficence, and non-malpractice. Autonomy, like require that the patient have autonomy of thought, intention, and action when making decisions regarding healthcare procedure. Therefore, the decision-making process must be free of coercion in order to patient make a fully informed decision. He must understand all risk and benefit of the procedure or the likelihood of success. And the second one is justice. The idea that burden and benefits of new or experimental treatment must be distributed equally among all groups in society. Requires that procedure uphold the spirit of existing laws and are fair to all players involved. The healthcare provider must consider 4 main areas when evaluating justice: fair distribution of scarce resources, competing needs, right and obligation, and potential conflicts with established legislation. Reproductive technologies create ethical dilemma because treatment is not equally available to all people. The third one is beneficence. Require that all the procedures be provided with the intent of doing good for the patient involved. Demands that healthcare providers develop and maintain skills and knowledge, continually updated training. Consider individual circumstances of all patients and strive for the net benefit. And the last one is non-malpractice. Require that a procedure does not harm the patient involved or other in society, and fertility specialists operate under the assumption that they are doing no harm or least minimizing harm by pursuing the greater good. However, because assistive reproductive technology have limited success rates, uncertain over all outcome, the emotional state of the patient may be impacted negatively. In some cases, it is difficult for doctor to successfully apply to do no harm principle. Now I would like to call upon my team member Tejal, who will be speaking on consumer empowerment.
I am Tejal Rathod from Ideal Medical Solution, and today I am going to talk about empower consumers in decision making through positive organization culture. Patient care is primary goal for any healthcare organization, and each healthcare organization wanted to succeed in patient care as best care provider. To achieve high quality care, organization must include patients in the treatment. Patients' engagement in the treatment fulfill individual and organization needs and aspirations. To provide patient-centered care is prime concern for healthcare organization and consider patient's perspective in treatment ensures clear based decision during treatment. Patient should be at the center of the care and should be owner of his treatment. A positive organization culture can achieve this criterion with active participation of patients and service providers, including clinical and non-clinical staff of organization. Patients should aware about the information sharing, participate in decision making. Partnership between patients and service provider will create a positive culture within the organization. There are lots of evidence which proves that patient participation in healthcare improves treatment outcomes. It is the it is the great achievement for healthcare organization to provide treatment with improved outcomes. Moreover, active participation of patients shows significant improvement in chronic disease such as diabetes, rheumatic diseases, mental health, and palliative care. Improved health literacy in patients plays an important role in shared decision making. Patients should know diagnosis details and possible treatment options. They should be aware with computer and internet-based health information. They should know about the access of the My Health record and efficient use of those data. Healthcare provider or staff of the hospital can help to improve the health literacy in the patient. Organization can give printed leaflets of My Health record and health information package. Evidence-based study proves that well-designed written information helps to improve health literacy in patients. Preoperative surgical leaflets provide all information regarding surgery and post-surgery information. Other resources such as website can helpful in Aboriginal and Torres Strait Islander as evidence showed that these types of resources become helpful to disadvantaged population and it gave high user satisfaction with beneficial effects on health behavior. Organization can encourage Aboriginal people to use these resources by counseling them for improved health literacy. Organization can also use mass media campaign to inform patients and public to promote specific behaviors and patterns of service use. The campaign will become helpful in rehabilitation of patients with substance use. Organization can also use patient decision aids to improve the decision making. Patient decision aids can be incorporated to empower patients in decision making. Organization can take guidance from the University of Ottawa's Health Research Institute as it has an inventory of such aids. These aids have been tested in several randomized controlled trials and systemic reviews are available to evaluate their effectiveness. It has been proved that decision aids improve agreement between patient preferences and treatment decisions as well as patient's health condition, possible treatment options, and outcome probabilities. The decision aids include video of treatment option and outcome, a structured interview with a clinical staff who help patients to express their preferences, accompanied with a booklet. The decision aids will become cost effective to organization as it is reported that evidence-based study of cost reduction in healthcare organization by the decision aids. Patients can be empowered in decision making with educational interventions. Coaching and question prompts for patients will improve their knowledge and will give better health outcomes. Communication skill training can be given to the healthcare professionals so that they can help to improve patients' knowledge, information recall, and increased participation in decision making. Patients can be encouraged to make decisions by patient-doctor communication. Increased health literacy not only improve decision-making involvement but also can help treatments, manage long-term conditions, increase safety of drug use and infection control. This will lead to better health outcomes. it is important to recognize the need of decision and incorporating patients' preferences and values during shared decision making. For example, according to physician, it is important to remove the cancer in patients suffering from cancer, but from the patient's perspective, patient wants quality life with the appropriate treatment. Now I am going to talk about the multiple level engagement of the patient. Patient should be engaged at the extended multidimensional level in the health and healthcare. Patients should be engaged at multiple levels. First one is the direct care. At this level, patients' values, preferences, and experiences are integrated with diagnosis, treatment, and prevention, including selection of healthcare providers and patients' health management. Second level is organizational design and governance. At this level, organization will take a survey of patient experience by feedback process. From the survey, organization can have suggestions for the improvement and hospitals can involve the patient in advisory council members or as an advisor. By this, patient will co-lead hospital safety and quality improvement committee. The third level is the policy making. At this level, patients will be asked for their opinion about healthcare issues. The recommendation will be used in funding decisions and they will have equal representation on decision making committee that makes decision about how to allocate resources to the health program. Now I am going to talk about the community partner in decision making. Physicians and clinical staff will play a major role in encouraging patients in decision making. But along with the staff, community can also have the partnership in decision making. Patients will be encouraged to connect with the community resources such as disease prevention and management professionals and health literacy organization. Organization can take partnership with the community organization of all 6 sites which will empower consumers of all sites to involve in decision making.
In conclusion, recognizing the high performing staff, rewarding them with incentives, giving them a platform to showcase their achievements, and also providing them with opportunities to help them prosper in their career path is an important aspect of building a positive organizational culture. Fiscal responsibilities of the staff include encouraging efficient use of supplies, incorporating patient health insurance information, and promoting the use of generic medicines wherever possible. The existing literature includes convincing arguments that increased levels of trust, commitment, and job satisfaction will significantly improve the overall organizational performance and its efficiency. Transparency in business requires entrepreneurs to remain open and informative about key points of information, including their business goals, history, performance, and operations. And it's a goal that's risen in importance and continues to do so. When important information is accessible, everyone will understand the goals of the company and feel empowered to make better decisions independently. Consumer empowerment can be supported by allowing consumers to control the process of their interactions with their healthcare providers, such as in accessing online health services, booking online consultations, and paying online. This allows the patients and their families to access their medical records online, which helps them create awareness about their own health. Enabling patients to generate their own personal health records can improve both health literacy and consumer satisfaction. We are grateful to Western Public Health Network Board for giving us an opportunity to serve them. Ideal Medical Solutions, dedicated to provide
Solutions that help
in delivering excellent
Patient care through
A harmonious company culture.
Thank you.